amongst very eminent individuals and personalities in yoga. Dr. Nagendra, nice to see you again. I think we met a couple of years back in Bangalore at Prashanti. And Rajendra, congratulations on organizing a fantastic program. I can see there's been a lot of different talks, a lot of different topics that have been covered, both theoretical and practical. You've given me the difficult task of talking in the last session after lunch, but you've been enlivened and woken up with some pranayam, so that's great. So my background is, I'm a urologist, so I work as a surgeon at the Epworth Hospital in Richmond. I've had a personal interest in yoga for probably 20 years or so, since days as a medical student. And even now as a urologist practicing as a surgeon, I aim to provide an integrative approach where I use conventional medicine and surgery, as well as that I use complementary therapies alongside. In my past life, you can say, before I went into surgery, I worked as a GP, and I used to practice complementary therapies as a general practitioner. So these days, though I don't so much recommend and prescribe natural therapies, I'm open to the approach, and I refer patients on to relevant practitioners who are experts in that field. So I just wanted to get a rough idea of people who are here. Some are yoga teachers. Any yoga teachers who are here? Yeah. And otherwise, people are just practitioners of yoga and have come to learn more about yoga. Is that fair? So in the field of urology, there's probably not that much in the literature actually about yoga. I was specifically asked to talk about prostate cancer, specifically related to prostate cancer. There's not that much in the literature. But I think when we're dealing with prostate cancer, whether it's as a practitioner, whether you are a family member of someone who has had prostate cancer, or whether you're just interested in health in general, it's really important to have a background and understanding about prostate cancer as a disease, because there are many black and white areas in prostate cancer, but there are just as many grey areas. Starting from whether you test for prostate cancer at all. This is controversial even within our field, between surgical bodies, between oncological bodies, between general practice associations. There is actually no consensus whether we should be testing for prostate cancer in the first place. Anyway, I'll leave this because I can go on for hours about PSA testing. With prostate cancer, it's very important to know that it's a heterogeneous condition. There's not one single entity called prostate cancer. And very often I get patients who come to see me who've had an elevated blood test and have been diagnosed with a prostate cancer, who instantly they hear the word cancer and they feel like they need to be treated. They feel like cancer equals, basically, a very severe kind of diagnosis, and they need treatment urgently. So it is a broad spectrum of disease, and when we look at prostate cancer as clinicians, we look at two broad aspects. So one is the patient, one is the individual, how old they are, what their general health is like, what their life expectancy is. And this is very important in prostate cancer because, as many of you will probably know, there are many types of prostate cancer that never cause problems. They just are there, and they say patients die with the disease rather than of the disease. So when we look at the actual cancer factors, there are two main things that we look at. One is called the grade of the cancer, and other is the stage of the cancer. So the grade of the cancer refers to how abnormal the cells are. So a very, very bizarre or abnormal prostate cancer cell is called a high-grade prostate cancer. If the cells are just a little bit abnormal, but they look kind of like normal cells, but not quite normal enough to be considered normal, then they'll be given what's called a low-grade definition. So the pathological grading system in prostate cancer is called a Gleason score. So anyone who's diagnosed with prostate cancer, the Gleason score is a very important thing. So the grade of the disease is important. Secondly is the stage of the disease. So stage of the disease refers to how far from the primary organ the cancer has actually gone. So whether it's just confined to the prostate, or whether it's gone outside of the prostate, whether it's gone more outside of the prostate, or whether it's gone distantly into the lymph glands or into the bones. These are the two areas that prostate cancer tends to go to. The other area that's important in terms of assessing the stage is the volume of disease. So when we diagnose prostate cancer, we do what's called a biopsy to make a diagnosis, and we take several biopsies, usually about 12 cores, 12 samples, and occasionally we get disease which is just confined to a single core. So 1 out of 12 will be positive, the other 11 are all negative, and even in that 1 out of 12 it's just a tiny, tiny focus, 0.5 millimeter or 1 millimeter of disease. And these kind of things impact on whether we actually need to treat the prostate cancer or not. So first question with prostate cancer is, does this individual with prostate cancer require treatment? So talking about black and white areas, there are prostate cancers that definitely need treatment, because these are prostate cancers that can pose a biological threat to life. So because I'm open and sympathetic to a holistic approach to health management and diseases, often patients get sent along to me who have been diagnosed with prostate cancer, but they're very anti-conventional treatment. They don't want to have surgery or radiation therapy. They just want to have some herbal treatments or yoga, so they want me to go down that line. But there are some instances where it's not appropriate to be purely having a complementary approach. It's more appropriate to have an integrative approach. So when we've got patients with high-grade disease, what we define as Gleason score 8, 9 or 10, or in patients with intermediate grade disease of 7, these are the kind of cancers that can cause harm over a person's lifespan. Generally speaking, prostate cancer is a slow-growing cancer. It's not like a pancreatic cancer or breast cancer. Some of these can be more aggressive. Prostate cancers are usually slow-growing. But once we start dealing with the intermediate and high-grade cancers, these have a higher chance of causing problems. The other aspect is the volume of disease. So if you have a patient with 5 or 10 cores that are positive, it's not appropriate to simply treat them with complementary therapies. It's important to know about the different treatments for prostate cancer, because the treatments don't come without any problems. Though the treatments can be very effective in curing the cancer, they can also cause side effects. So the kind of thing that I do, on a regular basis with surgery of prostate cancer, it can unfortunately cause damage to the urinary control, so the ability to be continent. And it can also cause problems with the erectile nerves, so it can create impotence. As well as that, it's surgery. So surgery is an invasive procedure. Even though these days we tend to do surgery with keyhole type surgery, so it's much less invasive, it's still a surgery all the same. The other two treatments for prostate cancer are external radiation therapy and seed radiation therapy that's inserted directly into the prostate gland. And these are also, they can be just as effective as surgery, but they cause a different kind of side effects, such as irritability of urination and irritability of the bowels, bleeding in urination, bleeding from the bowels. So these are the kind of things, if you have someone who comes to see you as a yoga teacher asking for advice about whether their prostate cancer should be treated, it's quite useful just to have a bit of a background and framework as to what kind of prostate cancer it actually is. So each of the treatments has their pros and cons. None of them is perfect. And there are also other investigational treatments. For example, often when patients are given the diagnosis of a prostate cancer, the first thing they do is go to Google and get on the internet and read about all the different kinds of treatments. And though this is useful from an educational point of view, it can also lead to a lot of confusion, because there's a lot of different treatments that are available, some that have been tried and tested, some that have been never tested, and so I think it's useful to have that kind of basic understanding. So in patients who have been diagnosed with a prostate cancer that in my opinion needs a treatment, then where is the role of yoga and other complementary therapies? And I see 4 main roles of yoga and complementary therapies in patients who've had treatment, whether it's surgery or radiation. So one aspect, of course, is just general health. We all know that yoga improves general well-being, immunity, energy levels, and all of those kind of things. So whether you're having a surgical treatment or a radiation, it's going to help you recover from the insult of a conventional therapy. Secondly, there are some things in yoga that are prostate specific, and I'll mention those towards the end of this talk. Asanas, pranayamas that are more specific to the prostate gland. Thirdly, it can be useful in preventing and managing complications. So, one of the side effects of treatment is problems with holding the urine. Yoga asanas can be very useful in strengthening the pelvic floor. So that's one aspect. And thirdly, if you've had a successful treatment for prostate cancer, being a regular yoga practitioner, staying in good health, will prevent relapse of disease. So these are the ways that yoga and complementary therapies can be used alongside conventional treatments. There is a different kind of prostate cancer which can be defined as a low-grade, low-volume prostate cancer. And probably 10 years ago, if you were diagnosed with any kind of prostate cancer, you'd end up having a treatment, whether it's surgery or radiation therapy. These days, we now have probably at least 10 years worth of experience of monitoring prostate cancers, certain kinds of prostate cancers, which are defined as the lowest grade and small volume disease. And these can be considered unlikely to pose a biological threat. These are the kinds of prostate cancers. If we happen to do a biopsy on a man aged 80, in about 80% of men we'd find some kind of prostate cancer. Low grade, low volume, never destined to cause any problems. In patients who undergo this particular kind of observation, which we call active surveillance, patients are monitored with a blood test, PSA, with a regular physical examination, and the biopsy is repeated at 12 months down the track usually. And an integrative approach using yoga and complementary therapies is actually ideal in this situation. Doing a literature search on yoga and prostate cancer, there's actually not a whole lot that comes up in the medical literature. And it's also very difficult to separate the effects of yoga asanas and pranayama from other complementary modalities that are used within the same package of treatment. Often there's a synergistic effect of the whole package, whether it's diet, nutrition, exercise, meditation, yoga, all of these things can act in a synergistic way. So is that actually important to be able to differentiate what is causing the effect? From a patient point of view, absolutely not. If I have prostate cancer, I'm going to use whatever it takes to try and get better. From a clinician point of view, it can be useful when we discuss this with our colleagues, with other clinicians, to be able to say, look, this patient has been diagnosed with prostate cancer or coronary artery disease. There is now ample evidence in the literature to suggest that we should be using this. And probably 10 years ago, within the conventional medical community, we were very much blinkered about the possible benefits of complementary modalities. But I think what I've seen in the last 10 years whilst I've been working as a doctor is the broader medical community is opening up, and excellent work that's being done around the world, which is giving medical and research credence to the beneficial effects. So for example, I work at the Royal Melbourne Hospital as my public appointment, and I was very surprised a few years ago that I was asked to give a talk on meditation. 10 years ago that would never have happened at a very conservative institution like the Royal Melbourne Hospital, so it's good to see these kinds of changes happening. So there's one particular article in the urological literature that is important to mention, and Dean Ornish is a cardiologist in America who has done work on coronary artery disease, particularly on lifestyle, yoga and meditation, and he also did a study on yoga and prostate cancer. So I'll just go into this. This was published in the Journal of Urology. So this was a group of 93 patients, the blood test, which is PSA, all the patients had a PSA ranging between 4 and 10. In order to be diagnosed with prostate cancer, they needed to have a proven biopsy. And in order to be included in the trial, they had to meet the criteria for active surveillance. So it was all low-grade disease, Gleason 6 or less, and small volume disease. So disease that was unlikely to cause a threat to a patient's life, quite safe to monitor, and perfect to do this kind of trial. And essentially there were two groups. One group was the experimental group, which was asked to make some changes in their diet, their lifestyle, exercise, yoga, supplementation, meditation, all these things. And the other group, which was just a normal surveillance group, who had a normal surveillance with blood tests, physical examinations, etc. And what they found in the experimental group is the blood test, the PSA, actually reduced in the experimental group, whereas in the control group it went up. So it went down by 4% in the experimental group, it went up by 6% in the control group. The other thing that they checked was a particular laboratory prostate cancer cell called LNCAP to see whether these cells were inhibited by the lifestyle changes. And they found that the prostate cancer cells were inhibited about 8 times as much in the experimental group. So, this is a good study. There were some limitations to it. These are some of the interventions that were included as part of the study. So as you can see, it's very difficult to work out what's actually working, whether it's the meditation, whether it's the vitamin E, whether it's the vitamin C. And there have been particular studies on things like vitamin E and selenium, which in large randomized studies have not been shown to be beneficial in prostate cancer. But when all of these things are put together, I'm sure they act in a synergistic way, and it can be very difficult to actually measure these things. So patients went on a diet, fish oil, supplementation, exercise, various yoga, meditation techniques, and a support group. Fairly similar to the cardiology intervention in the Dina Ornish trial. So the actual specifics of the study, the PSA decreased by 0.25 nanograms over the 12 months, whereas in the control group it went up by 0.38. Was it statistically significant? Yes, the p-value was less than 0.05. Was it clinically significant? Possibly. It's a small group, it's a short duration. For prostate cancer trials, we usually study things over a 10-year period to see whether it's actually significant in terms of survival, cancer-specific survival and overall survival. But it's an important study, and I think more of this kind of study with longer follow-up and larger numbers will be beneficial. So in the meantime, whether we actually get the evidence or not, in our field of urology, there were 2 very, very large studies that came out a couple of years ago to address a very fundamental question. Does testing for prostate cancer save lives? PSA screening, does it actually save lives? One of the studies, there was 180,000 people. Another study, there was 70,000 people. Multi-center, randomized, all of this. Both studies were equivocal. One said, yes, there was about 20% benefit. The other study said there wasn't much benefit. So in the meantime, I think whilst we're waiting for evidence to arrive, and such evidence may never arrive in the field of complementary medicine and yoga, I think, why not integrate? So if I develop prostate cancer, what would I do? So firstly, I'd get a specialist conventional opinion. So see a urologist who can give their opinion. Often it's very black and white, high-grade disease, a lot of cause positive, patients needs treatment. But often there's a lot of grey areas. So if it was me, I'd actually get a second opinion. Go and see another person recommended by someone and see what they have to say. It's really important to read widely and educate oneself about the condition. Be aware of unproven, expensive and anecdotal treatment. So there's a lot of stuff out there, buyer beware. Finally, come to a decision. So having considered all the evidence, having got counsel from specialists in the field, done all your reading, etc., come to a decision and stick with that. And utilize a sensible integrative approach. So that can include diet, supplementation, exercise, yoga, meditation, counseling, group therapy, all of these things. And then having made a decision, for example, if it's a surveillance decision, it's important to monitor and be flexible to change. So I see patients, some patients who've been sent to me because I'm open-minded to this kind of approach, who unfortunately the horse has already bolted and we've missed the boat for treatment, and they've got a PSA in the hundreds or thousands, and the window of opportunity for treatment is actually gone. But in patients who are on active surveillance, it's important to be flexible and open. If despite doing all the right things with diet, etc., yoga, meditation, the PSA still continues to go up, or on repeat biopsy the grade of the cancer is higher, one needs to be open to change, and if conventional treatment is required, fine. There's no point being dogmatic and then developing advanced disease. In terms of how I integrate yoga, my approach is very simplistic. Most urologists are fairly simple people. There are several well-established risk factors such as family history and high-fat diet, but the way that I see the human body is, the body is like a river. The river contains lots of different things like arteries, veins, nerves, lymphatics, and things that we can't measure with conventional instruments. And it's important for there to be a free-flowing flow of movement of all ingredients in the body. And stagnation can lead to disease. So the way that I integrate yoga is with the concept that yoga asanas can increase blood flow to the pelvic area, thereby hopefully helping the situation. Asanas can also strengthen the entire pelvic floor. Now, because I'm not a yoga teacher, I'm not going to demonstrate any of these postures, but there's a range of different things that increase blood flow to the area, and that's basically how I utilize yoga. I refer my patients off to a yoga teacher who can actually teach them some of the exercises, and I don't think these things need to be done in isolation. They should be done as part of an overall program, so an overall yoga program where they also include some of these specific asanas which increase the blood flow to the pelvic area. Thank you very much for asking me to come along. I won't go over time. Thank you.